If you are a man over the age of 50, you've likely noticed subtle, frustrating shifts in your lower body vitality. Your natural physical response slows down, sensitivity decreases, and you find yourself waking up 2 or 3 times a night with a persistent urge to urinate. Most men immediately blame falling testosterone levels or assume their vascular system is simply succumbing to inevitable biological aging. When things stop functioning reliably, they turn to temporary pharmaceutical shortcuts, hoping a single pill will compensate for a complex physiological decline. However, clinical urology and pelvic neuroanatomy reveal a far more fundamental, mechanical reality. The underlying issue is rarely just hormonal. In a large majority of men over 50, the primary barrier to male performance and urinary health is a physical restriction known as pelvic floor hypertonicity, a chronic, silent spasm of the deep muscular sling supporting your bladder, prostate, and vascular channels. Years of prolonged sitting, sedentary compression, and chronic sympathetic stress leave the pelvic muscles locked in permanent tension. This tension acts like a kink in a garden hose, directly strangling the primary nerve pathways and arterial branches that supply your pelvic organs. In today's protocol, we are breaking down the clinical mechanics of pelvic vascular entrapment and revealing the exact 60-second perineal decompression technique scientifically proven to release deep myofascial tension, restore endothelial nitric oxide release, and reactivate natural pelvic circulation without medication. To understand why this simple mechanical intervention is so potent, you must examine the deep anatomy of the male pelvis. Suspended across the base of your pelvis is a dense muscular hammock known as the pelvic floor, primarily composed of the levator ani, bulbospongiosus, and ischiocavernosus muscles. These muscles converge at a central anatomical anchor point located between the base of the scrotum and the anus, known clinically as the perineal body or the central tendon of the perineum. Directly beneath this compact muscular junction lies the primary neurovascular superhighway of the male reproductive tract, the Internal Pudendal Artery, and the Pudendal Nerve. In younger years, these pelvic muscles remain elastic, contracting when necessary and immediately returning to a relaxed resting baseline. But in modern sedentary living, an adult man spends an average of 9 to 11 hours a day, seated in cars, at desks, and on couches. This constant mechanical pressure compresses the perineal tissue, while daily psychological stress activates the sympathetic nervous system, causing the pelvic floor to clamp down into chronic microspasms. Over years, the muscle fibers shorten, become fibrous, and lose their natural elasticity. This chronic hypertonicity creates mechanical nerve impingement and arterial occlusion. When your arterial branches are physically compressed by tight muscle tissue, blood cannot reach the cavernosal chambers efficiently, and the sensory branches of the pudendal nerve become desensitized. Prescription medications attempt to force chemical vasodilation, but they cannot stretch a physically tightened muscle sling. To restore lasting function, you must mechanically release the tension at the anatomical source. The physiological basis of targeted manual stimulation rests on a proven biological process called mechanotransduction, the mechanism through which cells convert physical mechanical pressure into biochemical signals. When you apply sustained, targeted ischemic pressure to the central perineal tendon, you stimulate specialized sensory nerve endings called Golgi tendon organs and Ruffini corpuscles. These receptors register the mechanical pressure and instantly send an inhibitory reflex arc through the sacral spinal cord, forcing hyperactive pelvic muscle fibers to abandon their chronic spasm and fully lengthen. As these compressed muscle bundles relax, 2 immediate vascular reactions take place. First, the physical kink in the internal pudendal artery is removed. The sudden restoration of blood volume creates fluid shear stress against the inner lining of your blood vessels. This mechanical friction signals the vascular endothelium to produce and release localized nitric oxide, the essential signaling gas that commands smooth muscle cells in arterial walls to dilate and widen. Second, targeted perineal decompression triggers an immediate autonomic shift. Performance issues and pelvic stiffness are driven by chronic sympathetic dominance, the fight or flight state, which systematically shunts blood away from the reproductive tract. Stimulating the perineal nerve network stimulates the pelvic splanchnic nerves, flipping your central nervous system into the parasympathetic state, rest, recovery, and tissue perfusion. This autonomic reset lowers resting heart rate, eases systemic blood pressure, and creates the exact biological environment required for natural, sustained circulation. To perform this technique safely and effectively, precision and anatomical accuracy are essential. Here is your official step-by-step clinical execution protocol. Step 1. The decompressed position. Sit comfortably on the forward edge of a sturdy, flat chair with your feet flat on the floor, slightly wider than shoulder width apart. Alternatively, perform this while lying flat on your back with your knees bent and feet resting on the mattress. This ensures your lower abdominal and gluteal muscles are entirely disengaged. Step 2. Locating the perineal body. Identify the soft muscular space located directly between the base of your scrotum and the anal sphincter. When you gently palpate this central point with your index and middle fingers, you will feel a firm, slightly sensitive, tendon-like tissue resting just beneath the surface. Step 3. Applying targeted ischemic pressure. Using the pads of your index and middle fingers, apply steady, upward pressure directly into the central perineal space. The pressure should be firm, but completely pain-free, approximately the same gentle force you would use to test the ripeness of a piece of fruit. Step 4. The circular oscillation. Maintain this gentle upward pressure while making slow, controlled circular rotations for 30 seconds in a clockwise direction. Pause for 5 seconds and then execute the circular oscillations in a counterclockwise direction for an additional 30 seconds. Focus entirely on consciously releasing any subconscious clenching in your pelvic floor. Step 5. The bioactive transdermal catalyst. To enhance cellular penetration and reduce friction, apply a few drops of cold-pressed castor oil or black cumin seed oil to your fingertips before beginning. Castor oil is rich in ricinoleic acid, a unique fatty acid clinically demonstrated to penetrate deep dermal layers and downregulate local inflammatory cytokines. Black cumin seed oil delivers thymoquinone, a potent antioxidant that supports local capillary perfusion and tissue oxygenation. The benefits of daily perineal release extend far beyond vascular performance. They directly impact the health of your prostate and bladder neck. Directly superior to the perineal body sits the base of the prostate gland. When the pelvic floor remains chronically hypertonic, it exerts continuous upward mechanical pressure on the prostate and the urinary sphincter. This mechanical compression causes low-grade congestion within prostatic venous plexuses and irritates the trigger of the bladder. The nervous system misinterprets this constant pressure as a full bladder, leading to the frustrating reality of nocturia, forcing older men to wake up 3 to 4 times per night to pass small amounts of urine. By executing the 60-second perineal release each evening before bed, you immediately alleviate the resting physical pressure against the prostatic capsule. To multiply this effect, pair the massage with diaphragmatic piston breathing. Your respiratory diaphragm and your pelvic floor are structurally linked in a biological piston. When you inhale deeply through your nose, expanding your belly for 4 seconds, your diaphragm moves downward, which naturally pushes and expands the pelvic floor outward. As you slowly exhale through your mouth for 6 seconds, the pelvic floor gently recoils. Taking 5 deep diaphragmatic breaths immediately following your 60-second massage delivers natural rhythmic decompression to the prostate, clearing venous congestion and promoting uninterrupted restorative sleep. To turn this biological intervention into lasting structural rejuvenation, consistency is paramount. Here is your daily Apex Pelvic Restoration Blueprint. First, dedicate 60 seconds every evening before sleep to perform the manual perineal decompression using cold-pressed castor oil, followed by 5 cycles of deep diaphragmatic piston breathing. Second, incorporate a 10-minute brisk walk immediately following your largest meal of the day. The reciprocal movement of your hips and legs mechanically pumps lymphatic fluid out of the pelvic basin, preventing blood stagnation. Third, break up long periods of seated immobility. For every 60 minutes spent sitting, stand up and perform 30 seconds of gentle pelvic tilts or light hamstring stretching to prevent the levator ani muscles from locking into spasm. Most men begin to notice subtle improvements within 7 to 10 days, manifesting first as deeper, uninterrupted sleep with fewer nighttime bathroom trips, followed by reduced lower back stiffness, improved baseline energy, and a significant resurgence in natural circulatory responsiveness by week 3. Your biology is not broken. It does not require extreme chemical intervention when the primary obstacle is mechanical tension. Free your vascular pathways, restore your pelvic elasticity, and take command of your biological vitality. If you found this clinical breakdown valuable, hit the like button right now, share this protocol with someone who needs it, and subscribe to Apex Longevity for more evidence-based cellular blueprints. Stay disciplined, and we will see you in the next protocol.